All right, so good morning, and we're gonna do congenital heart defects. It's crucial that you understand the basics because when patients come to the lab, again, the heart is not labeled. So if you stick to basics, you can make assessment and you can go through your studies. So what we're going to do is we're going to look at the definition of the different types of congenital heart defects. We're going to attempt a classification, even though it's probably not complete. We're going to look at the echo identification of these congenital heart defects using two-dimensional images, color flow, continuous wave, Doppler, and then look at the signs and symptoms that the more common signs and symptoms that these patients present with, and then how to finally make the diagnosis. So we're going to attempt to do that. When we talk about congenital heart defect, it is a defect in the structure of the heart and great vessels presenting at birth. So it's not only heart defect. We look at the great vessels. And when we say the great vessels, we talk about the aorta and the pulmonary artery. Congenital heart defects occurs in about 9 per 1,000 births. It's one of the leading cause of birth defect-related deaths in babies. Even though we're going to use this classification, you can use any classification that incorporates essentially all the defects. You don't want to leave out any of the defects. So this is the 2000 International Heart Surgery classification or nomenclature. But again, you can use any classification that give you a complete picture of congenital heart defects. So when we say hyperplastic lesion, that means there's poor development of structures. So hyperplastic lesion, that's an underdevelopment of either the right or the left ventricle. And when we talk about hypoplastic left heart syndrome, so it's the underdevelopment of the left side of the heart, the left ventricle. And hypoplastic right heart, similarly, underdevelopment of the right ventricle. So on the hypoplastic left heart syndrome, we have a poor development of the left ventricle. So essentially, the left ventricle is not functioning. Remember, the function of the left ventricle is to pump blood across the aortic valve into the aorta. So if you don't have the left ventricle taking part in this, the coronary, the heart circulation, then you need some communication between the right heart and the left heart. And so for these babies to survive, they need a PDA. Remember, your PDA connects the pulmonary circuit to the descending aorta. Okay, so if you have that type of connection, then these infants can survive. However, they may need surgery. All right, so this is the hypoplastic left heart syndrome. And then when you have hypoplastic right heart syndrome, remember what the right heart does? It pumps blood into the pulmonary circuit. So,
excuse me, Doc, aren't we supposed to be seeing something on the screen?
Okay. Hello?
Hello, Dr. Smith. How are you?
Oh, not too bad.
I just want to discuss the patients with you.
Okay. All right, sorry about that. So with the osteoprimum defect, it's a defect in the lower portion of your atrial septum. Okay, and you can see blood flowing from when you put your color Doppler on, you can see blood flowing from the left atrium across the defect into the right side of the heart. You can see the defect is lowermost. But if you look carefully, you can see that your AV valves are on the same plane. So again, your ostium primum is a type of AV canal defect. It's usually associated with a cleft mitral valve and mitral regurgitation. So you see that this valve is on the same plane. You can see the defect in the lowermost portion of the atrium. All right, so the sinus venosus defect occurs in less than 5% of your ASD patients. It involves usually the venous outflow of either the superior vena cava or the inferior vena cava. So it's very difficult to detect on your regular transthoracic echo, and you commonly need your transesophageal echo to make the assessment. All right, so your sinus venosus defect, again, is associated with anomalous connection of your right-sided pulmonary veins. So the pulmonary veins are usually drain into the right atrium or the superior vena cava. Okay, so you remember your sinus venosus type defects is commonly associated with anomalous pulmonary venous drainage. Okay, it's very important. So again, it may be you have to look high up in the atrial septum to see the sinus venosus defect. You may get a defect in the superior vena cava or in the inferior vena cava, so you have to look carefully for it. Okay, and again, so your transesophageal echo is going to be important. And when you think about sinus venosus defect, you have to always think in terms of anomalous pulmonary venous drainage, and you have to look for those as well. So your atrioventricular septal defect or your endocardial cushion defect is another type. As we had mentioned before, your ostium primum defect is usually a type of your endocardial cushion defect or atrioventricular septal defect. So one way to make your assessment of this type of defect is to look at the AV valve. If the AV valves are on the same plane, you're more than likely dealing with an atrioventricular septal defect or endocardial cushion defect. So when we talk about your endocardial cushion, the septum in the heart sort of formed from one structure in embryonic life. They usually have the portion coming from the atrium, a portion coming from the ventricle, and then the AV valves. Okay? So, and these structures usually come together. So, in the developing embryo, this is from the atrium. This contribution is from the atrium. This contribution is from the ventricle. This is from, say, the mitral valve. And this is from your tricuspid valve. And they usually come to complete the structural integrity of the heart. But if everything forms and the atrial portion doesn't come down, you have the ostium primum defect. If everything forms and the ventricular portion doesn't go up, you'll get ventricular septal defect. And you usually get a combination of these defects. Usually the mitral portion doesn't come in, so you get a cleft anterior mitral leaflet, and you will get if the atrial portion doesn't come down, then you get the ostium primum defect, and you get your cleft mitral leaflet. Sometimes you get what we call the complete AV canal defect. The whole structure fails to complete, so you get your ASD, VSD, problems with the mitral valve and the tricuspid valve. Okay, so it's an abnormal or inadequate fusion of superior and inferior endocardial cushions with the mid portion of the atrial septum and the muscular portion of the ventricular septum. Okay, so that's essentially what it is. So when we talk about your partial endocardial cushion or your partial atrioventricular septal defect, so the ostium primum defect is partial. Okay, you can see that the AV valves are on the same plane. We've been teaching you that to identify the tricuspid valve and the right ventricle. The tricuspid valve is located lower in the ventricle than the mitral valve. But if they're on the same plane, you're probably dealing with the endocardial cushion defect. With ostium primum, it's a partial endocardial cushion defect, and you tend to get your cleft anterior mitral defect. So you can have your partial atrioventricular septal defect, which includes your ostium primum defect, and because you have increased blood flow on the right side of the heart, you can get right heart volume overload, pulmonary hypertension as a result. Or you can have your complete atrioventricular septal defect, where everything, the stuff didn't fuse. So you're going to have your ASD, a VSD, or you can have what we call a common AV valve. Okay? And in that situation, the valves are regurgitant. So when you have a common AV valve, that means it's just one structure forming your tricuspid and your mitral valve. And because you have increased blood flow in the right side of the heart into the pulmonary circuit, you get pulmonary hypertension. All right, so let's stop here. That's atrial septal defect, and we will do